Hey guys, I just wanted to jump on really quickly. I know I haven't been on in a couple of weeks. I don't know what's going on with me. I've just been seeing patients and ripping and running with my family. I am going to always try to do better though. I wanted to come on here today, and I've been having a lot of patients. Actually, a lot of patients, potential patients, asking me what test we're able to order. And so I wanted to let people know that we are able to order anything that we need. We have all of our new patients who are coming in for the Wellness Way aspect of the office to take a questionnaire, and also give us their medical history. Any blood tests that they've had in the last year or two are very helpful. And I just want to say this for instance. I actually have a very close friend, and she's been having some issues. And so she had some blood work done at her doctor's office, which was very helpful. And so when I saw the blood work, I immediately could tell that she was anemic just from the blood test. They didn't have an iron reading or ferritin reading, but I knew that she was anemic. And so she gave me the rest of her blood work, and it came up that her blood sugar was normal, her thyroid was normal, and her liver was normal. Now, mind you, and she was mildly anemic. So I think they were going to try to put her on iron, but now she is a patient here. So we are going to figure out exactly what's going on with her. But she is anemic, but we have to figure out if she has enough iron in her blood, or we have to figure out her values for her iron and her ferritin. You have to have those values in order to know how to help someone who is anemic, because they might have enough iron, they're just not able to utilize it. So, and so another aspect of her blood work was that her glucose, which they say was normal for her, was at pre-diabetic status. But they're telling her it's normal. So then that means that she can go on living her life the way she's living it until she gets into a disease state. So we don't want to have to get into a disease state before we do anything about it. Okay? Another thing that she had that really burned me up is she had her TSH value. And I spoke a little bit about TSH in December, and it's the thyroid stimulating hormone, which is made in the brain. And so that goes and it tells your thyroid to convert your T4 to T3. And so when I saw that, I was like, oh, they're telling her thyroid is normal, but they only have one value for her thyroid, and that is TSH, which tells you absolutely nothing about your thyroid function. You need to know the T4, you need to know T3, you need to know free T3, you need to know. There are like 7 or 8 values that you need to know. So we are going to test her adequately for that also. She is having some hormone issues. We're going to do a Dutch test for that. And so I just want to let people know that we can order the tests that are needed. We have access to that. We can send you out to the labs to get the blood work drawn. If it's a stool sample, we send you home with that. If it is a hormone test, we usually use dried urine for that. We can send you home for that. So we have the capabilities to get you better. Oh, and that's another thing. She has been having issues, like real issues. She's tired all the time. She has headaches all the time, but she's normal. Come on, guys. We got to do better. Mildly anemic. I don't want to tell all her issues, but the most of it was that she's tired all the time, she's lethargic, and she has headaches all the time. And the symptom I'm not telling you about should have you making better decisions about the test that you're going to give this young lady, and not telling her that she's mildly anemic and that glucose is normal, liver is normal, and thyroid is normal without adequate testing. Okay? All right, guys, we'll talk to you later. Bye.